what are the earliest markers that we can look to identify, and then look to limit the progression of plaque and disease? And how would you go about in clinic, perhaps? How would you go about with a patient? Okay, I'm going to assess. You're 40 years old, let's say, for example, and you're otherwise healthy. You don't have diabetes, but you're worried about your heart health. But of course, everybody has a bit of inflammation, and risk for heart disease is not negligible for anybody, right? So, 40-year-old guy coming in, what would you look at first?
So if the guy is truly, asymptomatic, then, I always break it down into the biophysical and the biochemical. So the biophysical is, what are going on with the arteries? So in my office, we assess patients' nitric oxide availability with multiple tests. You can start with just salivary nitric oxide testing. There's different vendors that make these test strips. You put saliva on them. The brighter red they are, the more oral nitric oxide pathways are working well. Then just just regular old blood pressure, checking blood pressure on both sides, the brachial arteries, because some people have a differential because they have subclavian stenosis or another problem with their arteries. So, take the arm that has the higher blood pressure, but your blood pressure really should be less than 120 over 80 millimeters of mercury at all times. Our device is a little bit more novel because we'll also assess central blood pressures. Those are the blood pressures that the coronary arteries, the aorta, the carotid arteries, and the vital organs all sense. And that's the pressure you're really monitoring. And so I was an invasive, cath lab guy. We were using pigtail catheters and measuring these pressures invasively, but people don't like me to put needles in them in the office. So we have a device that measures it non-invasively for them. A pulse wave velocity device. So most of them look like a pulse oximeter, clips to your finger, and it will measure your heart rate, of course. But as the blood leaves your heart and goes into that artery, if the artery is healthy, it's going to expand and contract. Healthy arteries are elastic arteries, so you can measure how elastic the artery is. That's pulse wave velocity. We have a device called the EndoPAP. It's a 15-minute stress test for your arteries, and basically we pump up a blood pressure cuff higher than your blood pressure, cut off the flow to your arm for 5 minutes, and then we open up the stopcock. The blood rushes back down into the arm. The reactive hyperemia occurs. So when that happens, the blood is interfacing with that endothelial glycocalyx, that protective coating. The body gets a signal, hey, here comes a big slug of blood. The underlying endothelium then releases the nitric oxide. The artery pops open, and you can measure how much it dilates compared to its baseline. And it should triple or quadruple in size. If it doesn't, then there's a nitric oxide availability problem. And then you can use the blood work to figure out, okay, is it high ADMA or uric acid or homocysteine or oxidized LDL? Do the blood work to figure out what's driving it. But if you look at just the blood work, you don't know what's going on with the arteries. So you have to do both.
How does stress play a role with prevention of heart disease?
It's definitely one of the main pillars that I talk about with patients. I mean, everybody's hyper focused on nutrition and exercise. I tell them it's important, but we got to manage your stress and we got to get you to sleep well if you're not sleeping well. Because if you don't sleep well, it doesn't matter what you do the rest of the day for the most part. Your mitochondria are not going to be working very well. So stress is ubiquitous. We all have it. We have mental stress. We having a conversation like this. Physical stress when you work out in the gym, and it's your body's. How well do you recover from it? The stress isn't the problem; it's the recovery part. And you got to sleep well, and you got to be able to turn it off when you need to. And there's certain genes that COMT for one, catecholamine methyltransferase. If you have an abnormal SNP, the COMT gene, stress takes a longer time for you to kind of recover from you. So you're probably going to have to do more meditation, more heart math, more biofeedback, more deep breathing exercises, cold plunging, whatever you like to do to kind of mitigate the stress, because stress is a killer, literally, if you don't know how to mitigate it. You keep your cortisol high, your adrenaline high, your arteries, endothelium is going to keep getting impacted by this. And so you got to find ways to monitor your stress and mitigate it if it's high. So the quick and dirty way is you can look at heart rate variability as a metric of how much stress your body's being, sensing right at that moment. It's not a perfect metric, but it's a good starting point for many people.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umar Khan. Looking forward to seeing you again. Thank you.